Most of what you accept today as inevitable signs of aging, like that stubborn swelling in your ankles, sudden dizziness upon getting out of bed, or even seemingly endless fatigue, may actually be a warning cry from your body reacting to the medication that should be protecting you. Amlodipine is undoubtedly one of the cornerstones of modern cardiology, responsible for saving millions of lives every year by preventing devastating strokes and fatal heart attacks. However, there is a silent and often ignored reality in doctors' offices. The metabolism of those over 50 or 60 years old does not process this substance as quickly as that of a young person. Pharmacological studies reveal that due to this natural biological difference, the medication can accumulate in the body, generating what we call a prescription cascade, where you end up taking extra medications to treat symptoms that are actually side effects. Today, we're going to turn this around. I'm going to teach you how to identify the 12 exact signs that your body may not be responding well to amlodipine, giving you back control over your quality of life. Before we move on, I need you to quickly answer this in the comments. Have you ever felt that after you started treating your blood pressure, other physical discomforts arose that you didn't have before? The central problem we face today is not the effectiveness of amlodipine, but rather the lack of active monitoring of how it specifically behaves in the aging body. It is very common to see patients who accept severe swelling in their ankles, fatigue that prevents them from enjoying their day, or that dangerous dizziness when getting up from a chair as if they were just things of age, an inevitable burden of aging. However, in the vast majority of cases, these sensations are direct physiological responses to forced vasodilation that their bodies are unable to compensate for. This confusion is dangerous because it affects mobility and drastically increases the risk of falls, which we now know to be one of the leading causes of loss of autonomy and morbidity in the elderly. When you cannot differentiate the symptom of the disease from the effect of the medication, you run the risk of undergoing unnecessary treatments to correct something that often would only require a fine-tuning of the dose. To help you take control of your health, we need to demystify how this medication works within you, using simple and transparent logic. Amlodipine belongs to a class of medications called calcium channel blockers. Imagine your arteries are flexible hoses, and to contract and maintain pressure, they need calcium entering the muscle cells of the vessel wall. What the medication does is literally close the door to this calcium, preventing contraction and forcing the arteries to relax and expand. It's like opening the tap on a pressurized hose. The water flows more easily and the internal pressure decreases, which is excellent for protecting your heart and brain from hypertensive spikes. However, this opening of the tap alters the entire hydraulic dynamic of your body, and that's exactly where side effects begin to appear if there is no vigilance. The critical issue for those over 50 or 60 is that the biology of aging changes the rules of the game, especially in the liver, which is the processing powerhouse for everything we ingest. In a young person, amlodipine has a half-life of 30 to 40 hours, but in the elderly organism, due to naturally slower hepatic metabolism, this time can jump to 50 or even 60 hours. This means that when you take the next pill the following day, the body has not yet fully eliminated the previous one, generating a silent cumulative effect. Furthermore, swelling in the legs, which studies show affects between 10% and 30% of patients, occurs because the drug dilates the arteries but not the veins, creating uneven pressure that leaks fluid into the tissues. Added to this, the baroreflex, our internal sensor that adjusts pressure when we stand, is already less agile with age, and the medication can accentuate this, creating the perfect scenario for dizziness and instability. To ensure you're no longer in the dark, I've organized the warning signs into a practical list of 12 key points, ranging from the most visible and common to the silent and dangerous ones that almost no one associates with medication. It's vital that you pay attention to each one, as knowledge is the only tool that separates safe use from unnecessary risk. The first item on our list is undoubtedly the #1 complaint in doctors' offices and the biggest reason for abandoning treatment. But I ask for extra attention to item 10, which is a rare but critical side effect, often mistakenly confused with serious neurological diseases. Let's uncover together what your body is trying to tell you. Let's start with #1, the absolute champion of complaints: peripheral edema, swelling in the ankles and feet. Have you noticed that at the end of the day, your feet look like little loaves of bread and the sock marks are deep in the skin? This happens because amlodipine relaxes the arteries to lower blood pressure, but it doesn't have the same effect on the veins. The result is a hydraulic imbalance. Blood easily reaches the lower veins, but has difficulty returning against gravity, leaking fluid into the surrounding tissues. It's crucial to understand that, in most cases caused by this medication, this doesn't mean your heart is failing or your kidneys have stopped working, but rather a mechanical consequence of vasodilation. To deal with this without panicking, the first step is not to rush to take a diuretic on your own, which can dangerously dehydrate you, but rather to adopt physical strategies. Elevating your legs above heart level for 20 minutes a day helps drain this fluid back into circulation, and the use of compression stockings prescribed by your doctor can act as an extra pump aiding venous return. If the swelling is severe and painful, talk to your doctor about adjusting the dose. Often, reducing milligrams or combining it with another class of medication solves the problem without losing cardiac protection. #2 is perhaps the most dangerous for your physical safety: dizziness and postural hypotension. You know that blackout feeling or slight fainting spell when you get up quickly from bed or an armchair? This happens because the baroreflex, the system that should adjust your blood pressure instantly when you stand up, is slower in the elderly and becomes even more sluggish with medication. The danger here is not the dizziness itself, but the fall it causes. A fall at this age can result in femur or hip fractures, events that unfortunately mark the beginning of the loss of autonomy for many. The practical solution is to retrain your movements. Never get up all at once. Adopt the 3-step rule: lying down, move to sitting, and wait a minute. From sitting, stand up supported and wait a little longer before walking. If you want to age independently without depending on anyone for basic tasks, protecting yourself from these falls is the smartest step you can take. And if this type of guidance makes sense to you, consider subscribing to this channel to receive more content that prioritizes your longevity. #3 often causes alarm due to its visual impact: facial flushing. That sudden redness and heat in the face and neck. Imagine that the microvessels in your face are small windows that suddenly open. That's exactly what rapid vasodilation causes. You feel your face on fire and may feel socially embarrassed, thinking your blood pressure has spiked, when in fact it's the effect of the medication dilating the peripheral capillaries. This symptom is usually more common in the first few weeks of treatment or shortly after a dose increase. The good news is that, for many patients, it tends to decrease as the body adjusts to the new blood flow dynamics. Do not stop taking the medication because of this, but tell your doctor if the discomfort becomes unbearable, as there are ways to mitigate this constant feeling of heat. Moving on to #4, we have heart palpitations. It's a frightening sensation to feel your heart galloping in your chest without having done any physical exertion. This happens due to a mechanism called reflex tachycardia. Because amlodipine lowers blood pressure, your body initially interprets this as a problem and tells your heart to beat faster to compensate. It's your body trying to help in a clumsy way. It's crucial to differentiate this reaction from a dangerous arrhythmia. If this acceleration happens right after taking the medication and subsides after a while, it's usually benign and tends to stabilize. However, if it's constant and accompanied by chest pain, a medical evaluation is essential. Understanding that it's a reflex response reduces the fear and allows you to observe your body with more rationality and less anxiety. #5 is silent and often mistaken for laziness. excessive fatigue, and sleepiness. While lower blood pressure protects your organs, it can slightly decrease oxygen perfusion to muscle and brain tissues, leading to tiredness that doesn't go away with sleep. You feel your body is heavier, and the daily tasks require twice the effort. The biggest risk here is the vicious cycle. Feeling tired leads you to stop. Exercising, your muscles weaken, and your overall health deteriorates. If you notice your energy has plummeted after starting treatment, don't blame yourself. Talk to your doctor about the timing of your medication. Sometimes, changing the medication to nighttime can help concentrate the peak of drowsiness at bedtime, improving your mood during the day. We've reached number 6, an effect that surprises many people: gingival hyperplasia. Yes, blood pressure medication can affect your mouth. Amlodipine can stimulate fibroblasts, cells in the gums, causing the tissue to grow over the teeth, becoming swollen, red, and sensitive. Many elderly people think it's just a dental problem, without imagining the connection to the pill they take every morning. Rigorous oral hygiene is your first line of defense, as inflammation caused by bacterial plaque greatly worsens this condition. Keep up with your dental appointments and inform them that you are taking this medication. In more advanced cases where chewing or aesthetics are significantly affected, the only effective solution may be replacing the molecule with another class of antihypertensive drug under the strict guidance of your cardiologist. Number 7 is headache or throbbing headache. The mechanism is the same one that protects your heart: vasodilation. When cerebral arteries dilate, they can press on sensitive structures, generating this throbbing pain. It's ironic to think that medication to prevent a stroke can cause headaches, but it's a purely mechanical and temporary effect most of the time. Generally, this symptom is self-limiting, meaning it disappears after the first few weeks of use as the brain adapts to the new blood flow. Simple analgesics can help during this transition phase, but if the pain is persistent and interferes with your life, it's a sign that the dosage may need fine-tuning to suit your metabolic profile. Number 8 involves nausea and abdominal discomfort. The muscle relaxation caused by amlodipine doesn't discriminate where it acts. It also affects the smooth muscle of the gastrointestinal tract. This can slow down digestion or cause a feeling of nausea and full stomach, even when eating little. A practical and simple tip that works for many patients is to avoid taking the medication on an empty stomach. Taking it with or immediately after a meal can lessen the gastric impact, significantly reducing discomfort without hindering the absorption of the active ingredient that controls your blood pressure. Number 9 refers to muscle cramps. Unlike the common spasms caused by exercise, these cramps can occur at rest, especially at night, interrupting your sleep. They may be linked to minor electrolyte imbalances or to the changes in peripheral circulation caused by the medication itself. Poor sleep is detrimental to the health of the elderly, increasing stress and even blood pressure. If cramps are frequent, stretching before bed and adequate hydration are essential. And remember, reporting this to your doctor is important, as they can investigate whether there is an associated excessive loss of minerals, ensuring that your sleep is restorative. Number 10 is rare but critical: mood swings or mental confusion. In frail elderly individuals, a very sudden drop in blood pressure can momentarily reduce brain oxygenation, causing irritability, apathy, or mild disorientation. The danger is that this is often, and wrongly, labeled by the family as the onset of dementia or senility. If you or a family member notices clear behavioral changes after starting or increasing the dose of medication, be alert. Don't assume it's neurological aging. Often, a simple adjustment in therapy restores mental clarity and vitality to the patient, proving that the problem was chemical and reversible, not degenerative. Number 11 is pollakiuria, the frequent urge to urinate, especially at night. Remember the swelling in your legs from item 1? When you lie down to sleep, gravity stops trapping that fluid in your ankles. This fluid returns to the bloodstream, passes through the kidneys, and becomes urine. The result? You wake up several times to go to the bathroom. This creates a double risk. It fragments your sleep and exposes you to the danger of waking up in the dark, often dizzy. Remember? Item 2. The strategy here involves elevating your legs in the late afternoon to try to mobilize this fluid before bedtime, allowing you to eliminate the excess while still awake, ensuring a safer and more restful night. Finally, number 12 stands for severe allergic reactions. Although rare, they do exist and require immediate action. If you notice sudden swelling of the lips, tongue, or intense red rashes and itching all over your body, don't wait. This is not a common side effect. It's a medical emergency. Discontinue use and seek emergency medical attention, as your safety is paramount to any routine treatment. Now that you have this complete map in hand, it's crucial to reinforce the most important message of this video. Amlodipine is indeed a valuable tool that saves lives every day, preventing tragic outcomes such as stroke and heart attack. The intention here was never to generate fear or suggest that you abandon your treatment on your own, which would be a very serious mistake for your safety. The real lesson today is that the effectiveness of the medication doesn't have to cost you your daily quality of life or your autonomy. If you identified with one, two, or several of these signs we listed, don't see this as an unsolvable problem, but as excellent, revealing news. This means that persistent discomfort, which you may have thought was just a sign of old age, has a name, a logical chemical cause, and, most importantly, an accessible medical solution. You don't have to live resigned to heavy legs or afraid of falling every time you get up from your chair. Fine-tuning is possible and is your right as a patient. The next practical step is to take this qualified conversation into the doctor's office, but now with a new attitude, that of an active partner in managing your own health and not just a passive spectator who silently accepts everything. Write down exactly what you feel, the times when the symptoms are strongest, and how this limits your home routine, as these are the fundamental pieces missing for your doctor to assemble the puzzle of your ideal treatment. Always remember that modern medicine has a vast and versatile arsenal, often simply reducing the dosage, strategically changing the timing of medication intake, or intelligently combining it with other classes of vascular protectors is all that separates you from a full life without physical limitations. Your doctor wants to see your blood pressure controlled, undoubtedly, but they also want to see you walking well, sleeping well, and living with as much independence as possible. I want you to visualize clearly now what your week would be like if these side effects were mitigated or eliminated. Imagine waking up without that inexplicable fog of tiredness, being able to put on your favorite shoes at the end of the day without swelling getting in the way, and having the necessary firmness in your legs to come and go without the constant fear of dizziness and falls. This is not a distant or impossible dream. It is a completely accessible reality for the vast majority of patients seeking the correct and personalized therapeutic adjustment. Aging with real health doesn't just mean adding years to your life, but ensuring that those years are lived with vigor, mental clarity, and freedom of movement. Your physiology has naturally changed over time, and it is expected that your treatment will also need to evolve to keep pace with this new phase, respecting the needs of your body as it is today, not as it was 20 years ago. We've reached the end of this journey of knowledge, but our conversation doesn't have to end here. I want to know from you, which of these 12 signs most impacts your life or the life of someone you care for today? Did you already suspect that stubborn swelling or that strange sensation could be directly related to the medication? Leave your honest account in the comments below. Your experience is valuable and helps other people in our community feel less alone and more understood in their pain. And if you know someone, a friend, a family member, a neighbor, who constantly complains of dizziness, swollen legs, or excessive fatigue while treating their blood pressure, do an act of care. Share this video with that person right now. This knowledge may be the missing key to restoring their well-being and avoiding unnecessary risks. Subscribe to the channel so we can continue together on this mission of longevity with autonomy and intelligence. Finally, an essential warning for your absolute safety and responsibility. All the information I have shared in detail here is strictly educational and informative, based on scientific evidence and the physiology of aging. This content does not, under any circumstances, replace the advice, diagnosis, or clinical treatment prescribed by your cardiologist or geriatrician. Never change the dose, cut the tablet, or discontinue the use of amlodipine or any other medication on your own, as the rebound effect on blood pressure can be dangerous and even fatal. Use the robust knowledge you have acquired today as a tool for dialogue at your next appointment. Take care of yourself intelligently, monitor your vital signs carefully, and until our next video, with more health and freedom for you.